We have several goals. One is that we are still doing a lot of research on AVMs. Every time I operate on them, we're taking the tissue from AVMs and also tissue from a remote area. We're testing those for different things. We're doing what we call DNA analysis. We're trying to show what's abnormal about them, and we are getting some answers already on that. So this is in our research lab that this is going on. Dr. Richter is overseeing that project. We also have worked again on the hormone receptors, and just in the last few weeks we again proved that the progesterone receptors were the primary hormones that stimulate the growth of these, and that can occur during puberty, during pregnancy, or taking birth controls with progesterone. We're still working on that, and we're working on the DNA analysis, trying to classify these at a molecular level. The other thing that in 2016 I'm doing is that I have a young woman who's a head and neck surgeon that I need to train for to take over my practice in the next 5 to 10 years. And she's coming in July and will be working with me for a year, and then we'll start taking on cases, and she's supposedly excellent, so I'm excited about that as well. Also, we're presenting almost 20 different research papers on AVMs and other vascular anomalies at our international meeting in April in Buenos Aires, Argentina. And we have a lot of different things we've been working on with AVMs. Part of it includes the drug treatment, and we're a group in Italy wants to collaborate with us to do some clinical trials on different medicines to try to stabilize or shrink AVMs. So this is another thing we're working on. And also in the next year, a lot of things going on, but there's a friend of mine is involved with what we call amniotic fluid stem cells. And this is amniotic fluid when patients have a pregnancy is delivered by a C-section. They take the amniotic fluid, and it has a lot of stem cells, and these stem cells are capable of growing almost any type of tissue. And what I would like to experiment with is to see if this amniotic fluid could be injected into AVMs to stimulate growth of capillaries, because that's the main problem with AVMs, is that there's an abnormal bed of capillaries and the blood shunts from the arteries directly into the veins. If we could somehow get the amniotic fluid stem cells to grow capillaries, it might be able to reverse the AVMs and make them more normal blood vessels. And so this is something I'd like to test this coming year as well. So that's a lot of things we're working on.